What I'd like to do is multi-layered presentation. One of the things I'd like to include is to give you a little bit of insight on the wide diversity of complementary medicine as we go through the presentation, but at the same time I'm going to relay some of my life experiences. It was mentioned that I started off as a chemist. I did a first degree in chemistry, but at the same time I was running a psychical research society in the university. So it was a lovely polarity for me. I think I kept both sides of myself going at the same time. But my journey through from chemistry into biochemistry, then into biophysics, was a fascinating journey of me trying to find an application for the sciences that I'd learned earlier on. So my journey is from bones to energy, but I'd like to give a little bit of insight of what things nudged me back into feeling that I was going on the right journey. For example, my PhD viva, which I thought was really going to be a really high point where I really felt I was there. I must admit, fine, it showed me that I knew more than perhaps I don't even think that's the case, perhaps more than anyone else on the topic, but really what I was left with was realizing that really I knew so much about so little. It was such a sobering experience to get there and realize, wow, there's so much more to learn. And for me, it was the start of a journey to really come out and sort of try and put things more into a human experience. Really, I suppose what we might be talking about are some of these words like well-being, words like resilience, those aspects of life that seem to be so far, even from my experiences as a biophysicist. So what did I do with that experience from a PhD? Well, natural place to go would be go and work in Africa. I had a post in Africa working in the medical school, so I could apply the sciences that I'd gained. And though in Africa there are so many lessons readily available for you, and that's what I found. There's an educationist speaking. I've been in education almost 40 years, and in education you think, well, yes, go through a course for your education. For me, some of my best lessons have been those that I've almost had in the field, just life experiences. And one of them was working with the School of Pharmacy. We were looking at medical drugs that are used to control symptoms, anti-emetic, against vomiting, anti-diarrhea, reduction of fevers. Very sensible, because obviously patients would present with those, but realizing that the local symptoms, and we got some of the local, we call them witch doctors, in. They will come with a line of volunteers to demonstrate their wares, and that was fascinating because they will give a minute amount of a particular medicine, and that person had to shoot out into the garden, and we could say fertilize the vegetation there. So it was there that obviously, talk about, well, where was ethical approval? No, but it was a very real experience of really quite a different experience. For me, I'd come from a medical background. My PhD was in the Medical Research Council. But to go out into Africa and realize that really, you know, was it really appropriate always to suppress the body's response, or was there something to be gained by stimulating it? Right? Now, as I go through the presentation, there will be 10 therapies I'll be touching on. One of the groups of therapies, this is a test for alertness, are we there? Right? The first one here, traditional medicines. Is there something to learn from traditional medicines? You know, I say that my time in Africa was one of the most concentrated learning experiences of my life. But after Africa, I realized that traveling can be a great education in its own right. Again, an experiment with no ethical approval, traveling with a friend. They took antibiotics because it was recommended that they take antibiotics against bacterial infections. I focused on making sure I consume local fermented milk products. What happened 6 months later, or 6 months after coming back, my friend was still being treated in a hospital for a bacterial infection that would not go away. I went to the Hospital of Tropical Diseases and I had a clean bill of health. For me, that reminds me that it's important to think about nutritional therapy, naturopathy, dietary advice. Very often these can be separate therapies, but for me, to encompass those in a more holistic approach is important. I'm an osteopath and a naturopath and a craniosacral therapist. As an osteopath, talk about joining the body. You know, you learn your anatomy, muscles at a time, joints at a time. For me, the fascinating thing is not what you learn in the lectures, but it's what your patients teach you. Classic example, a youth presented with neck ache, headaches. What was the problem? They'd been to see some therapists and the headache and neck ache hadn't gone away. Detailed case history. What had happened is a football tackle 6 weeks earlier. There was misalignment of the ankle joint. That had changed the articulation between the tibia and talus, had thrown the length of the leg slightly off, pelvic imbalance. Obviously then the body doesn't like walking along the road like this, not very comfortable, so there's a curve to correct, and obviously the fine-tuning is in the cervical region. Why do you get the headaches? Cervical restriction. What was the problem? The ankle. And it's the same, obviously, realizing that when you're learning your anatomy around the muscles, you don't learn them as individual muscles, you recognize they're a chain that runs throughout the body. This holistic approach is just so important. And I must admit, patients, when I ever feel that, no, I've got it, I know where, you know, the symptom is where the problem is, you realize that you very quickly then get a patient that says, oi, don't forget, look at me holistically. And it's very important as a journey. Okay, so what have I learnt through using CAM? Treating the whole person. It's very important to look at all of the domains. Obviously my background in chemistry, biochemistry, biophysics occasionally comes in, but obviously looking at nutrition, diet, looking at the structure is also very important. So treating the whole person, but also treating everyone as an individual. You can get into a habit, I think, as a practitioner, I'm speaking of my own personal experience, of feeling that a whole morning's been lower back problem and that's all you're doing, adjusting lower backs, but realizing that if you do adopt that approach, you'll only probably be successful with less than a quarter of your patients, because there's other things going on as well, for example, particularly with lower back pain. So tailor the treatment to meet the individual's needs, and that can include in osteopathy anything from remedial massage, manipulation, dietary therapy. Lifestyle advice there is really an all-encompassing component, and that being here at the conference today, I would say there is so much that really ought to be included under lifestyle advice, right? That is such an important way of working with your patients. And the other thing about working in a naturopathic, osteopathic way is remembering that your time with the patient is so limited. Obviously, if you're a GP, it's even more limited. I have the luxury of a half an hour or 45 minutes with my patients. You really are dependent upon them going away and being empowered, taking forward some of the suggestions, and obviously taking responsibility for their own health. So, but are there any other dimensions? In other words, you probably realize I've kept it quite structurally at the moment. If we look at many of the other therapies, cranial sacral therapy, healing, Chinese medicine, Ayurveda, Shiatsu, dotted lines there to say there is so much more in terms of the realm of complementary medicine that is really encompassing in terms of saying that it's not just the physical we're working with. Our patients are individuals, whole beings, and it's sensing and working with the non-physical, the energetic. So for me, is it possible working to contribute to balance the physical, biochemical, emotional, spiritual level? And you may say, well, the way I've presented this afternoon is around physical to biochemical to emotional to spiritual. I would say there's a journey from the right to the left there as well. That what goes on spiritually, what goes on energetically can affect the emotion, can affect the biochemical, and obviously can affect the physical. You very much see that in osteopathic practice, to be open to every individual patient. And perhaps one thing I'd like to, and I know this is something probably so many of you have read before, but really remembering, and I've had to have that for my own journey in complementary medicine, is keeping an open mind. Minds are like parachutes, they really do function best when they are open. Thank you.